Hello, my name's Ashley Schrock, and this is my community project presentation for Altman College. And my community project was on heart disease education. So this specific project was chosen for multiple reasons. Heart disease affects many individuals throughout not only America, but the world as a whole. As pointed out by the Centers for Disease Control and Prevention, heart disease is the leading cause of death for men, women, and people of most racial and ethnic groups in the United States. One article that I found stated almost 80% of heart disease is preventable. This is a very large percentage, especially when you think about the number of individuals who could have prevented heart disease. However, due to a lack of public education regarding the topic, um, there is a lot of people who have heart disease and are affected by it. So, for example, prior to nursing school, I honestly don't remember getting educated regarding this topic. In like the public school system, they talk some about, health and doing things preventatively and proactively to help your health in the future, but I don't specifically remember getting educated on heart disease itself. So, although 8 in 10 deaths from coronary artery disease happen in adults older than 65 years old, heart disease can occur in younger adults as well. Although it doesn't affect younger adults as often, by the time that individuals develop coronary artery disease when they're older, it's often too late to completely reverse the effects of this disease. Therefore, I believe it's important to educate individuals from a young age regarding heart disease in order to develop a healthy lifestyle, which helps to decrease the prevalence of heart disease. Heart disease prevention from a young age is key. The kinds of heart problems which relate to the problems adults have don't really manifest themselves until the children are much older, but the seeds of those problems are sown in childhood and adolescence. My goal with this class is to educate individuals and help encourage them regarding the importance of taking steps from a young age to prevent heart disease development as they become older. So here is a question to test your knowledge on the previous slide. So it says, why is it important to teach the general public about heart disease? You can kind of think about this. I included the answer in the notes page. However, it just says that almost 80% of heart disease is preventable. So that's kind of the goal with this education, is to help prevent individuals from getting heart disease. So that is why education is important. In this slide here, I talk about specifically why heart disease was chosen to educate the public on within Tuscarawas County. So my project site that I chose was Garaway Local Schools, which is located in Tuscarawas County. I used the Tuscarawas County Community Health Assessment results to determine if there's a need for heart disease specifically within the county. The table that I included in this slide shows and compares multiple factors that increase one's risk of heart disease. Based on these findings, it shows that Tuscarawas County had a higher percentage of individuals who had a heart attack or had been diagnosed with high blood pressure and high cholesterol than compared to the statistics from the state of Ohio and the United States in 2016. This proves the specific need for more education regarding heart disease in Tuscarawas County. So for example, if you look down in the chart, you can see under the adult comparisons, the adults who have been diagnosed with high blood pressure. And in Tuscarawas County in 2018, 39% of adults have been diagnosed with high blood pressure compared to the 34% in Ohio and 31% in the US. Therefore, individuals within Tuscarawas County specifically have higher rates of high blood pressure compared to Ohio and the US, which can therefore contribute to heart disease development. This next slide here talks about site project location. So like I said, I chose Garaway High School to focus on for my site project. This high school includes grades 9 through 12, and I included the address, which is in Sugar Creek, and the phone number for this location. The mentor chosen for the completion of the community project was Jennifer Chapman. She has her RN, BSN, CNA, MSN, and CNP. She is a family nurse practitioner, and she's currently practicing at a physician's office. And along with this, she also has her sexual assault nurse examiner certification. So the clients served and represented through this project would be any high school students that attend Garaway High School. As I mentioned before, the age range for that is between the grades of 9 through 12. In completing and showing the students the heart disease PowerPoint to different classes, teachers or faculty who may listen in on the PowerPoint would also be educated regarding this topic. However, this heart disease PowerPoint isn't focused for teachers necessarily. I tried to focus it more towards high school students and keep it entertaining and very simple and easy to understand for them. So structure and function of the project site. Since a high school was chosen as my course project site, students are assigned different classes. Typically, students are in each class for 45 to 60 minutes. Therefore, the presentation would have to be less than 45 minutes. As students most likely do not want to sit in a lecture for 45 minutes straight or a whole class period, it may be beneficial to incorporate a game or interactive quiz with the students to help them better engage in the learning process. It would be beneficial to present my PowerPoint about heart disease education to students in classes where teachers could incorporate teaching about healthy living and further expound on the topic after the presentation was completed. So the specific classes that would be best to present this PowerPoint in would include like science classes, physical education classes, health classes, or even a cooking class in which students might learn more about healthy eating habits, which could contribute to a decrease in the prevalence of heart disease. So I know I previously briefly touched on what was done for the course project, but I'm going to expound a little bit more on that topic here. So for the course project, I developed a PowerPoint presentation focused around the idea of educating high school students about heart disease. In developing the presentation, I covered the basic topics around heart disease and tried to format the presentation in a way that made it easy to follow along and also eye-catching to the students. I also did my best to use layman terms when developing the PowerPoint presentation, as the individuals reading the PowerPoint most likely have very little health background and therefore would have a hard time understanding medical terminology. So I wasn't able to figure out how to open this link here that I included. So I went ahead and inserted the heart disease presentation that I developed for the course project in the next 11 slides. So I'm just going to briefly go over those slides here next. All right, so this is just the title page for the heart disease presentation. Here I included the introduction and purpose of the presentation. I just talked a little bit about my role as a nurse and then the purpose of this PowerPoint for the students. Here I briefly covered what is heart disease. I thought this was important to include just to give the students who are reading this just like a basic brief overview of heart disease so they know a little bit more about the topic without going too much in detail as far as using like medical terminology and stuff like that. I wanted to try to stay away from that as much as possible to make sure that they were able to understand what was being presented in the PowerPoint. Here I talked about coronary artery disease, and I included the picture on the right-hand side, which helps to portray the buildup of plaque within arteries. And I thought that was just a good little visual representation of coronary artery disease that students would easily be able to understand. Here I included a test question for the students. So it says atherosclerosis is a result of the buildup of blank within the arteries, and the answer to that is plaque. Here I talked about some of the common signs and symptoms of heart disease, and I broke it down into the symptoms or medical conditions that people could experience as a result of heart disease, which included like a heart attack, arrhythmia, or heart failure. And then I specifically broke down the symptoms of each of these medical conditions. Under arrhythmia, you'll also see that I included a link to a YouTube video, which was just a fun little video that showed a heart rhythm dance. And I thought that was something fun that students would enjoy watching. Kind of help keep them entertained and engaged throughout this PowerPoint. Here I talked about the difference between modifiable and non-modifiable factors. This is important in order for the students to determine risk factors that they can or cannot change. On this slide here, I talked about more of the risk factors of heart disease. And then on the right-hand side, you'll see I did a little activity where I would have students break down the risk factors listed into either a modifiable or non-modifiable risk factor. On this slide, I talked about how heart disease can be prevented. I said that you could create a lifestyle focused around healthy habits, whether that's exercising or eating healthy, or maybe just taking time to enjoy activities that could help decrease your stress level. All of those things could help to decrease one's risk of heart disease. Along with this, I included a quote from the CDC, which said, "Take charge of your medical conditions. If you have high cholesterol, high blood pressure, or diabetes, you can take steps to lower your risk for heart disease." So that would just be encouraging the students to maybe follow up at their doctors for any medical conditions that they can have to help decrease their risk of future complications regarding these conditions. And then I had a homework challenge for the students. I said, think of 3 interventions that you as a student can take to decrease your risk of heart disease and implement these interventions in your life. You can make a difference in the health of your heart. And then lastly, this was my reference page specifically just for the heart disease presentation. So that concludes my presentation regarding heart disease that I would show the high school students. So back to the course project. The required 16 hours for the project were typically fulfilled throughout the course of approximately 3 weeks. I split up my time developing the project into smaller increments of 1 to 3 hours at a time in order to help make the project more manageable. The project that I developed for the school students would be presented to the students throughout school days, which range from 7 a.m. to 2:30 p.m. It would be best to present the presentation for students at the beginning of class to make sure that they were engaged in the presentation, as they may become more tired and restless by the end of the class. The time that the project would be presented would also be dependent on the teachers of the class and when it would work best for them to allow me to present my presentation to them. So the course student learning outcomes include utilizing frameworks and tools necessary to engage in evidence-based practice focused on the population's health, relate knowledge of epidemiology to determine the health needs of the community, explain the importance of culture and how it relates to community health, and summarize the framework, scope of practice, and competencies for the nurses working in the school setting. I also included the table of learning objectives, action plan, and outcomes. I believe that all of these outcomes were met in the development of this specific community project. If you want to pause the PowerPoint here and just look over those different things, you can. So the course project site goals and objectives. And there were multiple project goals and objectives that I developed. Developing SMART goals, which stands for specific, measurable, achievable, relevant, and time-bound, are important in achieving success with a project. One short-term course project goal is that by the end of the heart disease PowerPoint presentation, all students will be able to recognize at least 3 factors that cause heart disease. In order to measure this goal, I could have the students take a quiz at the end of the class in which they would have to write down factors that cause heart disease. This is important in helping to ensure that the students are retaining the information being taught. One long-term goal with the development of education program is that within 5 years, the percentage of individuals who have heart disease in Tuscarawas County will decrease. This could be measured based on the results of the Tuscarawas County Community Health Assessment results in 2025. This could help to show that the teaching regarding heart disease prevention is effective. Reaching the goals these goals can make a difference in the health of individuals living throughout Tuscarawas County. So cultural competency. Providing for different ethnicities and cultures is an important part of the school system. As pointed out in our textbooks, the characteristics of the major cultural groups that make up a community must be understood along with those aspects of the community that give in its unique subculture. It is necessary for nurses to be aware of cultural interpretations of healthcare activities so that they know what questions to ask and interventions to suggest. Cultural competence within school systems is just as important in helping to ensure that all students receive high quality education that they deserve regardless of their ethnicity or culture. So how do you display cultural competence at your current place of employment? This is just a little something to think about and challenge yourself with. So, Garaway Local Schools provides for different ethnicities and cultures. Chuck Zobel, who is in charge of the Garaway Virtual Academy, stated in an interview with myself that speaking mostly of our English language learners populations, we have hired tutors and translators to help with the language barriers. We have also used virtual learning to help best educate these students. I included the racial breakdown at Garaway in the slide here. As you can see, a majority of the students who attend Garaway are white. However, Hispanics and African Americans also make up a small percentage of the individuals who attend Garaway. As with most schools, Garaway also makes it a point to provide to children with disabilities. For example, they offer special classes which are specifically developed for children with many different types of disabilities. As pointed out on Garaway's website, the Garaway Local School District is locating and evaluating children from birth through 21 years of age in an effort to serve people with disabilities, including developmental delays, health impairments, autism, and traumatic brain injury. As Chuck Zobel pointed out, for disabilities, those are normally handled by individual education plans. Depending on the severity, students may receive accommodations in their learning to special services all the way to one-on-one aid. So as you can tell, this can really range. The amount of help that students get with disabilities can really range just based on their disabilities and developmental delays that they may have. I was very impressed with both the course project site and the staff at the site. I graduated from Garaway in 2017, so I was already pretty familiar with many of the staff members. Chuck Zobel specifically was very helpful in answering any questions that I had regarding some of the services that Garaway offered. Garaway also makes it a point to include evidence-based practice in their services. Evidence-based practice is important to follow in many different types of facilities, as it can be used to help ensure a high-quality service is provided to many individuals. In an interview with Chuck Zobel, he pointed out the different ways in which Garaway incorporates evidence-based practice into the services that they offer. He said, "We use testing and virtual programs to provide the data that we use to adjust learning. For example, we use a program called iReady to determine current levels of understanding and to differentiate teaching practices for our students." There were multiple services that Garaway offered which made a good impression on myself. However, the one that stuck out to me was that they have hired tutors and translators to help with any language barriers that students may have. This could even be beneficial when there are language barriers between teachers and parents, as it's very important that there's open communication between both teachers, parents, and students. Translators can play a large role in helping to ensure that students with language barriers still receive a high level of education, regardless of the primary language that they may speak. One service provided that could use improvement would be the use of a one-on-one student aid. Although these individuals are very beneficial for many students, based on school funding, many schools are unable to provide these aids to all students who need them. With unlimited funding, Garaway could improve student learning outcomes by increasing the number of one-on-one aids to help students. I also know that the process of securing a personal aid for a student with disabilities can be quite extensive. However, this is a result of the lack of one-on-one aids that many school systems have due to funding. So if I had unlimited funds, this is something that I would change. A service that I didn't know about before this course project site was that they offer the one-on-one aids. Although, like I had mentioned previously, it is pretty hard to ensure that the students who need one-on-one aids have them. They are very important as they help by providing instructional support with academic programs, language support, behavior support in terms of assisting your child and adjusting to classroom settings. So as you can see, they help students with many different things. So a lot of information was learned throughout the completion of the project. The project helped me to determine that there was a specific need for health education within my community, and also helped me develop a project to help fight this issue. This project could have a positive impact on the health of individuals who read the PowerPoint presentation, which was developed specifically for the high school students. The project also allowed me to learn a little bit more about the many services that Garaway offers to their students, which can play a large role in the students' learning processes. Here is my reference page and my student identification badge. Thanks for listening.